In this comprehensive script, we will explore the field of vaccination from the perspective of microbiology, with a focus on various vaccine-preventable diseases. Vaccination is a crucial aspect of modern medicine and plays a pivotal role in controlling the spread of infectious diseases. By stimulating the immune system to produce a protective response against specific pathogens, vaccines have saved millions of lives and significantly reduced the burden of disease worldwide. Now, let us delve into the first topic of discussion. Summarize in 33 words. In the next section, we will cover the epidemiology, vaccination strategies, and clinical implications of hepatitis B, a viral infection that affects the liver and is transmitted through blood and other bodily fluids. Chickenpox, caused by the varicella-zoster virus, is a contagious infection with rash and fever. The varicella vaccine not only prevents chickenpox, but also reduces the likelihood and severity of shingles, a reactivation of the virus. Vaccination is crucial for preventing complications, especially in vulnerable individuals. In the next section, we will discuss the human papillomavirus, HPV. HPV is a sexually transmitted infection that can lead to various cancers, including cervical, anal, and oropharyngeal cancer. Vaccination against HPV has been shown to be highly effective in preventing these types of cancers. Meningitis, characterized by inflammation of the protective membranes covering the brain and spinal cord, can be caused by several infectious agents, with Neisseria meningitidis, meningococcus, and Streptococcus pneumoniae, pneumococcus, being the leading bacterial pathogens. Vaccination against meningococcus and pneumococcus has significantly reduced the incidence of meningitis and related complications. Meningococcal conjugate vaccines and pneumococcal conjugate vaccines are routinely administered to infants, adolescents, and other high-risk groups. Epidemiological surveillance remains crucial in monitoring the prevalence and circulating strains of meningococcus and pneumococcus, allowing for targeted vaccine development and vaccination strategies. The flu, caused by influenza viruses, changes each year, so vaccinations must be updated annually. Vaccines may vary in effectiveness, but they reduce the severity, hospitalizations, and transmission of the flu. Vaccinating a high percentage of the population also protects those unable to get vaccinated. Human papillomavirus is the most common sexually transmitted infection globally, and certain high-risk strains are associated with the development of cervical cancer and other anogenital cancers. Vaccination against HPV has been a significant breakthrough in preventing HPV-related diseases. The HPV vaccine, usually administered in adolescents, targets the most prevalent high-risk strains. It has proven to be highly effective in preventing HPV infections, reducing the incidence of cervical precancerous lesions, and decreasing the burden of cervical cancer. Additionally, HPV vaccination also offers protection against genital warts caused by certain HPV strains. In the next section, we will explore the topic of pneumococcal infections and the vaccines targeting Streptococcus pneumoniae. Sorry, the given text exceeds the 33-word limit. Here is a revised summary. Streptococcus pneumoniae causes severe respiratory infections. Pneumococcal vaccines target this bacterium, offering protection against common serotypes. Vaccine efficacy depends on age, immune response, and serotypes. Breakthrough infections are possible, prompting ongoing research for better vaccines. Pertussis, or whooping cough, is a contagious respiratory infection caused by the bacterium Bordetella pertussis. Vaccination has reduced the disease burden, especially in infants. Combination vaccines like DTaP stimulate antibody production, protecting against pertussis. Challenges include maintaining high vaccine coverage and combating waning immunity, which are addressed through booster doses and cocooning strategies. The MMR vaccine has been a cornerstone of childhood vaccination programs, effectively preventing the spread of measles, mumps, and rubella. Despite its success, vaccine controversies have emerged, leading to vaccine hesitancy and outbreaks in some regions. MMR vaccination not only provides individual protection but also contributes to the establishment of herd immunity, where a sufficient proportion of the population is immune, preventing the transmission of the diseases even among the unvaccinated. Furthermore, MMR vaccination-induced immunity is crucial in preventing serious complications associated with these viral infections, including encephalitis, meningitis, and congenital rubella syndrome. Moving on to our next topic. The Haemophilus influenza type B, Hib, vaccine has been successful in reducing severe infections caused by this bacteria. It is given in multiple doses to infants and has significantly decreased the incidence of meningitis, pneumonia, and other severe illnesses caused by Hib. Tetanus, caused by the bacterium Clostridium tetani, is a serious infection that affects the nervous system and can be fatal. Vaccination with the tetanus toxoid vaccine is a highly effective method of preventing tetanus and should be administered regularly to maintain immunity. This comprehensive approach of combining active and passive immunization, along with proper wound management, ensures optimal protection against tetanus and reduces the risk of its complications. In summary, vaccines are essential for preventing various infectious diseases, such as hepatitis B and tetanus. They have greatly reduced sickness and death globally. Ongoing research and education are key to maintaining vaccine effectiveness and high immunization rates.